Everybody, Sam here with my wife Vanessa, and we want to talk with you about the Slishman Traction Splint C for compact, and we're going to do a little compare and contrast with the Hare type of traction splint that has been around for many years. A little bit of history. So about 25 years ago during my residency, I saw products like this, and I thought, surely there is a better way to stretch a leg. And so 25 years later, we have something that looks like this. I've been working with a company called Rescue Essentials for a long time on this. And however, evidence-based medicine hasn't really caught up yet. There haven't been a lot of articles saying this is better than that. And I think part of the reason is, EBM article people do publications because of things that are questionable. So is Moderna, Pfizer vaccine, which one is better or worse? Or which one is better or worse with Zofran versus Phenergan for treating nausea? In this case, it's just very obvious. There are 14 points here that I'll go through to talk about the differences. But I'm going to apply this and we'll go through all 14 points. So, for starters, obviously, it's a lot more compact. You can fit this into any cabinet just easy. That you have to dedicate a large space. You can put this in a backpack, your trunk, anywhere, and this just fits. That, no.
So go ahead and start applying it. So we kind of give the story. I said we keep attending events, and anytime we see an ambulance, we ask what traction splint they're carrying. And a lot of times they say the Hare Traction Splint, and when we see the size and the weight, it's So we see videos out there where people still train on how to apply traction with this. So we figure it would be useful to be able to point out the differences by having them side to side.
So compact is one point, light is another point. This weighs less than a pound. The Hare type traction splints weigh considerably more than 5 pounds. And I should back up a little bit. I don't like to talk about competing products very much. This is not one product. These are knockoffs from a product built by Glenn Hare in the 1960s. And what he did back in the day, they improved on the Thomas traction splint. So they added adjustability here, this kickstand, and there's a ratchet system to make stretching the leg better. But frankly, it's just very, very overbuilt for the job. I mean, to stretch a leg, you need 5 to maximum 30 pounds of traction, and this thing will, stretch a rhinoceros leg. I mean, with this strap here, you can lift a car off the ground. So this gets the job done a lot easier. So it's very lightweight. Also, number 3 here, it doesn't extend past the foot at all. So as you see with the Hare Traction Splint, if I have somebody tall, I may have to load them into the ambulance the other way around with their feet going in first just so I can close the door. There are helicopters where you can't even...
Doesn't fit at all.
Yeah, you can't even put them in. This will fit in a Stokes basket a lot easier too.
And so Sam, you just applied this on me, and it took like under a minute. This was previously applied before the video. I've watched the videos where people are training on how to apply the Hare splint, and they usually have at least 2 medics doing the procedure. This is something you just did by yourself. You didn't need help from anybody providing manual traction before applying that.
Yeah, so this is something that takes, one practitioner, or you could even self-apply it. That's one of the points down here too. So self-application. This is a very simple product to put on. It doesn't require a lot of movement of the leg while putting it on, which means the patient's in less pain. And if you're in the back country and you have this, you could put it on your own leg.
Okay.
So I'll go through some more of these. Okay for a proximal fracture. That is a listed contraindication with this. So a lot of protocols have been developed around the Hare Traction Splint. And it's because there's a bar here, which sits directly under the proximal aspect of the femur. And if you have a fracture proximal to it or right there, then it's more of a fulcrum. So you have to have x-ray vision when you're taking care of your patient to see where exactly that fracture may be. With this product, you just put it on the leg. It's a splint first, that just happens to offer traction. So I put it on the patient's leg and I pull a little bit of traction. They say that feels better. That's great. You don't have to worry about the location within the femur where the fracture may be.
Yeah, and as you mentioned that, people aren't able to see the bar under my leg, but it is uncomfortable. I figure if you have a bigger patient, a heavier patient, it just creates a lot more discomfort.
I mean, it hurts now and you don't have a broken leg.
Pretty much. Yeah, it's just awkward.
Yeah. So another point here, radiolucency. You come to the trauma room with that on, probably people are going to take it off so that they can get a better x-ray or CT scan. This here is relatively radiolucent. You still see the spring button and a couple of metal screws there, but this does not obscure a view of a femur fracture. So you can leave this on from your ambulance through the trauma room all the way up to the operating room if you want.
Yeah, so you have mentioned that before. So this is something that people, like if they get to the ER with this product, then there's more manipulation of the patient. They need to remove it to the x-ray. So that takes away patient comfort, which is kind of the focal point of providing the traction. Just
Yeah, that's a large fraction of what we're trying to do is help people not feel pain.
So.
All right, so now what about this one? This is a really big point, one of the biggest. So if I have an ankle sprain or a laceration down here, a tib injury, or maybe I don't even have a lower leg anymore, I can't use this product. There's nothing to grab hold of there. But here, if I have lower extremity trauma concurrent with a femur fracture, I can still use this for providing traction. So that's one of the biggest differences. Another one size fits all. So this, I can put this on my 5-year-old, and if you have a 6-footer or a 7-footer, it'll still work for femur traction. This one, they actually sell a pediatric version of it. So when we talked about compact, this is bulky, but you actually have to own two. You have to own a pediatric version and an adult version, which is a lot of space. So now I wrote here crushed pelvis. So if you have a patient who has a crushed pelvis and a femur fracture, once again, not supposed to use this. But in this case, you still can. You can put a pelvic binder, pull the pelvis back together, and that's what you should do first because that's a more life-threatening, more dangerous thing. And then you put the traction splint directly over it. And so still works. Traction from the hip is a big difference as well. So this one is was a different dynamic. I'm down here and I am pulling and it's me against my patient. Up here, when I want to apply traction, I put this in my patient's hand. I say, hey, we're going to pull this together until you feel maximum relief. Then you lock it in place. And so you can actually teach patients to adjust and readjust in the emergency department. What I find is initially I put this on to a patient, I'll leave for a little bit, come back. Very often they haven't adjusted at all, but it's positively loose. And what's happened is the muscles have relaxed, it's stretched out, and it's almost like the splint is wearing the patient. And that's just fine. As long as the patient says, I feel better, that's great. We talked about self-application and then no loose parts. So the only other part that is loose within this is a pressure wrap, which I use to wrap both feet together for some rotational stability. But you can do that with curlex, shoelaces, or anything you like to hold some rotational stability. This does not have loose parts, so you're not going to lose these extra ankle hitches that come with the Hare Splint.
So I think that
this one here has a large size and a regular size, and very frequently in your trauma room, people will find the splint, and then they say, where'd that ankle hitch go?
Where's the part? And I think not only for application times, right, but we consider also training. When you're training your personnel on how to apply a traction splint, if they got more loose components, then they're more prone to be losing some of the parts. If you have everything connected, as it is on the Slishman Traction Splint compact, then that's not something you have to worry about.
Just better.
Yeah.
I call this a multi-tool because of the addition of this. So you can use this for bleeding control as well. This is the Slishman pressure wrap. Last couple lines here. So it's better in a trauma room. If I need to roll a patient to examine their back, do a rectal exam, just move them around, it's a lot easier with this product.
Less things on the way.
Right. And then lastly, just for examining the patient, part of taking care of someone who has a femur fracture, you want to make sure that they still have good neurovascular status down below. I can get to their foot. I can see, all right, you can move your toes, you can feel, you have good sensation, you have good pulses here. So it's just better. And I don't think there's going to be a white paper that says that. There's not going to be evidence-based medicine published because this is it's just obvious.
Yeah.
So,
but what we believe that, ambulances and all these medical centers, they need to basically catch up with technology. It's smaller, it's lighter, it's faster to apply. So it seems like a no-brainer. So if you see organizations are still using this, you need to tell them that they need to move up to.
You gotta tell your medical directors you're asleep at the switch, and yes, please catch up. All right, if you like this video, like and subscribe, and
then email us if you have any questions. Thank you so much.